Hello students, welcome to Ganviar School of Education, Suresh Ganviar University. I'm Dr. Sonia Kaur Bansal and today I will be teaching you the topic Behavioral Disorders in Children. The first part we have already covered and now it's the second part in the subject Psychology of Teaching and Learning. So let's understand more about it. What are the behavioral disorders in children in continuation? So we are going to understand about in the learning objectives like introduction, definition, and you will also be able to understand students about the causes of behavioral disorders. You will also be able to understand and grasp how the types of behavioral disorders exist in different forms. You will also be able to understand the assessment of common behavioral disorders, how they are assessed, and then you will be able to understand the description of behavioral disorders, and conclusion part will be there. So let's understand students, and I really hope that you will be listening attentively and you will enjoy the class as well as you will understand the concept of behavioral disorders in children. This topic is really very interesting and it's important as well for as you are all are going to become teachers. So prospective teachers must understand what kind of behavioral problems are there with children, so that your teaching would be shaped into a proper form. You will be applying proper methodology, proper technique in the classroom, so that maximum learning part can be covered. All right, students, so let's understand. Now, first of all, let me introduce you. Behavioral disorders include many attentions activities that appear during childhood at various level of development, and some of these habits which are actually not proper. So habits development from adults through imitation, whereas other as purposeful movement. So behavioral disorders actually some sort of behavior which is not acceptable by the society. So when children cannot adjust to a complex environment around them, they become unable to behave in the socially acceptable way. And this really tortures themselves also and others also, and resulting in exhibition of a peculiar behavior, and this is called as behavioral problems. So this is how we have discussed about what is behavioral problem in short, and we have recapitalized what we have studied in earlier video lecture. Now let's understand students disorders caused by physical deprivation. Disorders caused by emotional deprivation we have already studied, and now it's turn for physical deprivation. So there are some the disorders which we are going to discuss with its symptoms and management as well. So first of all, in physical deprivation, that is neurosis. So neurosis refer to bedwetting after the age of 5 years. It is common pediatric problems in which repeated voluntary urination takes place at an age in which voluntary bladder control should have established. Children feel shame about it and they feel frustrated sometimes. And not only children, their parents also feels frustrated as the above 5 years age if the child is suffering from neurosis. So it can be of two types: primary neurosis and another is secondary neurosis. Primary neurosis is something where the child is never dry at night and occurs as a result of rigid bladder training by parents who are over anxious all the time. And the another form is secondary neurosis, that is characterized by initial control of bladder that later gets disrupted by stressful environment. So stress plays an important role in this type of neurosis because as the child gets stressed, so the bedwetting occurs more and more frequently. Now, symptoms can be repeated voiding of urine into bed or clothes, and soiling themselves, So the management can also be possible. So it is suggested that do not give excess fluid to a child after 6 7 p.m. and make the child void before going to bed. It's really very important that these are the small things that from the part of parents can be done easily. Then do not give strict bladder and ball training. Let it be in a natural form. Wake up the child once or thrice at night to void. That will really be helpful for the parents as well as the child to get rid of this problem. Reward the child for dry nights. If the child gets dry nights, then you must appreciate, then you must reward him so that this behavior will continue. Now, next physical deprivation disorder is incorporesis. So, what is incorporesis? So, it is repeated voluntary or involuntary passage of feces of normal or near normal consistency in place not appropriate for that purpose. So, something is also incorporating that neurosis versus incorporesis. Now, causes maybe subconscious anger is there. The child is there, might be with some emotional problems that he's dealing with inside. Then there may be the reason of psychosocial stress, like entering in a new school and leaving other behind, leaving the old friends behind. So this is some kind of subconscious anger which is actually reflecting through this problem. Now, how can it be managed? So, do not give too strict toilet training to the children. That's really advised. And educating parents that toilet training is a developmental process which happens in time, and let it take place with due course of time. If some parents are actually forcing the children to get the toilet training at a very early age, then they might get some kind of pressure in among themselves. So provide a sufficient time to them and just wait patiently for their toilet training. And also give them minerals and vitamins if deficiency is there. Give family counseling about the problem as well. These tips will really helpful in managing this problem. Now, next problem is tics. So, what is the tic? First of all, understand it. So, a tic is a non-voluntary body movement or vocal sound made repeatedly or suddenly. So, they appear to be manifestation of discharge of tension. So something is there that vocal sound is being made by the children repeatedly or suddenly. So it is of the following types which we can discuss. First of all, simple tics, and it involves only few muscles or sounds that are not words. For example, nose wrinkling, facial grimace, jerking, the neck, and shrugging the shoulders. These are all involved in tics. Then there might be complex tics also, and it involves multiple group or muscles or complete words or sentences. For example, making some motions with hands repeatedly, touching or smelling an object repeatedly, and holding body in unusual position. So this is considered in complex tics. Then third type is related to sensory tics. So sensory tics is something where repeated or unwanted or uncomfortable sensation arises. Repeated feeling of blinking the eyes. So these are the types of tics where the body is actually not in full control and the person or the child is showing these type of behaviors. Then phantom tics is also there. So it is the least common type in this out of body variation takes place. And the person feels a sensation in other people or object as well. For example, in phantom tics, the person experiences relief by touching or scratching the object involved. So this is really something that causes behavioral disorders among the children. Now, how can we manage this? So there are some tips for that. So it is advised that tics should be ignored by caregivers while working with these children. More care should not be given. Allow the child to discuss concerns related to schools and family. And also refer child for medical evaluation if tic does not decrease. So these are some points which I hope really will be helpful in controlling the tics problem. Now, next, another important behavioral disorder problem related to physical deprivation, that is nail biting. We all know about nail biting, but it can be a problem, behavioral problem among many children. And so, understand about it. What is nail biting? It's a common habit of childhood. It is usually an overt evidence of anxiety in older children. So children bite their nails when they get stressed, when they get tensionized. So sometimes thumb suckers change to nail biters as they grow older. Now, what can be the symptoms of nail biting? Biting nails of all the fingers. You will see the hands of those children, those who are actually continuously biting their nails, that their nails will never grow. They will be having short nails, and they will be not very in a even cut nails shape. It would be entirely rough. The cuticle, skin margins, surrounding tissue of the nails get affected very badly. So nail cutting is painful, and the child may use this as a form of self punishment. So these are the symptoms of nail biting. Now, how can we control this? Or how can we manage this? So it is advised that assess the psychological environment for the child. Just find out what is the important issue that is remaining around him, and what are the psychological pressures that the child is facing. So do not scold or punish the child for it if he shows the behavior nail biting. Use a bitter substance applied for nails so as the child is touching. This can be a very traditional method, but believe me, it is also helpful. So keep child's hands soft by applying lotion or warm oil. So caring itself heals many things. So if you are carrying the hands and it is being touched by mother or father, and the care is being given, the child is talking to them, so you will realize that gradually this thing will vanish. Now, next we are going to discuss about Pika. So what is Pika? Let's understand about it. It is eating substances other than food, like clay, sand, plaster from walls. So these are not non-eatable things. But in Pika, when there is behavioral disorder, Pika, so the child is actually craving to eat such things. The child loves to eat sand. So these are the symptoms. So it is frequent in the first year of life, but may be seen in grown-ups as well. Okay, students. So now symptoms may be lack of appetite, the proper food supply is not there. Lots of hair collection in stomach may be the one of the reason. Intestinal and parasitic infection may also be showing the symptoms of Pika. Mineral and vitamin deficiency may also lead to this. Now, management. Provide treatment of worm infestations, provide psychotherapy, proper supervision of parents is necessary. So these are some points which can be easily managed by the child or the person. Provide treatment of worm infestations, provide psychotherapy, proper supervision of parents is really very necessary. So we have understood that Pika is also can be cured and provide treatment of worm infestation. This is related to actually stomach infection. So if stomach infection is cured, then child is going to learn more and more about it, and the child will be actually showing some goodness in his behavior, and disorder will be really solved. So proper supervision of parents is really necessary in this case. Now, next important behavioral disorder is thumb sucking. So thumb sucking is very common in childhood, and we parents think that it's a normal process. But sucking is the infant's chief pleasure, through which they get love, affection, and satisfaction as well. So infants do thumb sucking if they lack oral satisfaction. So, what are the causes of thumb sucking? Let's understand. Infants are deprived of sucking and breastfeeding. So, if the mothers are not properly feeding the child, or there is some kind of problem with mothers medically, that mothers are not able to do that, so the child gets actually emotionally deprived. So, this type of behavior is being shown by the child. Manifestations of feeling of insecurity is the main cause of thumb sucking. So lack of bonding between parent and child, if there are more two or more siblings, and the parents are not paying attention on child, so the child feels insecure in the environment, and somehow the child is actually manifesting his own insecurity in this way. Sign of boredom, stress, and isolation is also there. So child is always alone. Nobody is there to take care of him, and the child is actually somehow not comfortable with the environment he is living. So these are the causes of thumb sucking. Now, how can we manage this thumb sucking problem? So some tips are advised to the parents that they should not show anxiety till the child is 4 years old. So showing anxiety to the children will lead to the great insecurity and anxiety tension among the children. Always praise and encourage the child, which helps to give up thumb sucking. This would be the only solution if the parents really want to get rid of thumb sucking. Mother should fulfill the needs for sucking by allowing for breastfeed if it is conveniently possible. If it is not, then some other proper nutrition must be given to the child. Proper food supply should be given to the child. Now, next is attention deficit hyperactivity disorder. This is ADHD. So we are going to understand about it in detail also, but let's understand in brief that it is a condition that affects the behavior of children, which is marked by persistent inattention, hyperactivity, and impulsivity. So attention deficit hyperactivity disorder is really for a great concern for the teachers as well as for parents, because these type of children are really hard to control. And what are the symptoms of these behavioral disorders? The child will show hyperactivity in all the cases. Impulsivity is there. Disorganization of the things would lead to another symptom. Inattention in studies, whatever the activity the child is doing. Distraction is easily for such children who are suffering from ADHD. The difficulty in making and keeping friends. So, how can we manage such things, and how these ADHD can be controlled? So, parents can create small, manageable goals for their child, like sitting in chair for 10 minutes and giving rewards for its completion as well. Because the child is hyperactivity, and the child is never going to sit at one place for so long. So these are the small goals that the parents can give to child for increasing his stamina, for controlling his behavior. Sleeping for extra half hour sleep in dealing with restlessness will also work to a great length if the child is sleeping. So start practicing good health habits. Then make sure that child gets plenty of opportunities to play with the friends, with their family members as well. So this will actually solve the hyperactivity problem among the children. Now, disorders caused by social deprivation, we are going to understand them one by one. We have studied now emotional deprivation disorders and physical deprivation disorders, and now we are going to study about social deprivation disorders. So, first of all, we are going to understand juvenile delinquency. So, what is this juvenile delinquency? It is defined as an individual under the age of 16 who fails to abide the laws. So, this is something under the age of 16 who fails to abide the laws. Many cases you must have heard about juvenile delinquency, and this is something that shows its characteristics by the behavior is marked by violation of law. Law is nothing for them. They actually believe in persistent mischievousness, and they are these type of children are involved in antisocial behavior, which is not the behavior which is not acceptable by the society at all, that gives pleasure to them. And disobedience is the main characteristic of these children, that you can see the pictures that crime, smoking, creativity remains hidden for such children, suicidal tendency or jail, unable to fulfill dreams and not interested in studies. These are all the symptoms of characteristics of juvenile delinquency. And it's really a matter of great concern for teachers as well as for the parents how to deal with them, but it's really very important to understand. So interventions can be done here, and in what way? So delinquent court seeks to provide protection and safety of public and of minor who has come in contact with court. So minor cases can be dealt with guidance and counseling as well. Special facilities like juvenile correction homes are there with provide safety and supervision of the delinquent child. So family should act as a role models and support their child always in any situation. This is the behavioral disorder that's really very difficult for the family members also to deal with it. But interventions must be there because the child has to be reformed and come to the mainstream of the society. So, in conclusion, we can say the behavior disorders include many tensions reducing activities that appear during childhood at various levels of development. So, in this education, to parents is a part of this process which helps parents to guide their children as well. So, education plays an important role in guiding, in shaping the behavior of the children. And if the behavior disorders are really going up very high, so definitely some professional and psychiatrist help must be taken. So now next understand students, school phobia. So school phobia is something that all of you must have heard, but you must have not thought about it, that it can be a great problem or it can lead to social disorder problem. So, school phobia is also known as school refusal or school avoidance. In this condition, the children don't want to go to the school and they just want to be away from the school all the time. They don't like this school. Children who resist going to school or who demonstrate extreme refusal to attend school for a sustained period of time are said to have school phobia. So these children actually demonstrate signs like leg pain, headache, nausea, vomiting, etc. And sometimes when the school time is here, the child says that today I'm not feeling well, I can't go to school. And this can be seen every day or frequently. Or the child can show severe symptoms during the examination as well. So, how can we manage this? So, treatment depends upon the cause. So examine the relationship of child with the teacher and with the peer group. What kind of relationship the child is sharing with them? It's really very important. Is the child suffering from some sort of ragging or some sort of pressure in the school? That has to be find out by the parents. And reward the child for going to school on daily basis. Professional child consultation is needed in severe problem if it is not being solved. So school wellness teachers or guidance and counselors must give their proper services to the such children. All right, students. So now let's understand others like speech problems. Speech problem is also a behavioral disorder among the children. So first of all, it's stuttering or stammering. We all know that it is fluency disorder, beginning with between 3 to 5 years, probably due to inability to adjust with stress. It is characterized by interruptions in the flow of speech. Hesitations must be there, spasmodic repetitions, etc. So the child is not able to speak fluently as others are speaking around him. And cluttering. So cluttering is characterized by unclear and hurried speech in which words tumble over each other. So these are awkward movement of hand, feet, and body. These children therapy. So awkward movement of hand, feet, and body, and plus unclear and hurried speech in which words tumble over each other. The child is not able to deliver clear speech when it is required. Now, dyslexia. Dyslexia, it is the disorder of difficulty in articulation which is caused by abnormalities in jaw and palate. So the child suffers from this pain also. Now, how can we manage it? So speech disorders are managed by behavioral modification and relaxation therapy. Sometimes the child is cluttering or stammering just because the child is not relaxed. So reassure the child and help in breath control exercise, meditation, yoga also helps a lot in that. Speech therapy can be given to such children. All right, now let's understand some common points of managing behavioral disorders. So discipline the child first of all. Discipline is a key point of a good behavior. Everything is sorted out if the discipline is here at home or at school. Discipline doesn't mean that you have a very strict sort of behavior over the child. Discipline means you are doing the right things at right time and you are following the time schedule by taking care of your health as well. So behavior modification is must. Strategies of ignoring must also be included in behavior. Now let's understand important disorders ODD, CD, and ADHD. So the most common disruptive behavior disorders include first is oppositional defiant disorder, which we can also call ODD. Then conduct disorder, that is CD. Then attention deficit hyperactivity disorder, that is ADHD. So these three behavioral disorders share some common symptoms to diagnosis that can be difficult, time consuming. A child or adolescent may have two disorders at the same time. The child may suffer from ODD or ADHD along with it. So other exacerbating factors can include emotional problems, mood disorders, family difficulties, and substance abuse, etc. So let's understand ODD first of all, what it is. So oppositional defiant disorder is this is, and around 1 in 10 children under the age of 12 years are thought to have oppositional defiant disorder, with boys outnumbering girls by 2 to 1. Some of the typical behaviors of a child with ODD include easily angered, annoyed, or irritated. Frequent temper tantrums must be visible. Argues frequently with adults, particularly the most familiar adults in their life, such as parents. So, refuse this type of behavioral disorder. If the child is showing, then he definitely refuses to obey rules. Seems deliberately try to annoy or aggravate others. Then low self-esteem is there, low frustration threshold is there. Seeks to blame others for any misfortunes or misleads. So around 1 in 10 children under the age of 12 years are thought to have oppositional defiant disorder, ODD. So it's really very important for parents as well as teachers to understand that ODD is really very dangerous if it is not treated properly. Then let's understand conduct disorder. That is CD in short. So children with conduct disorder are often judged as bad kids because of their delinquent behavior and refusal to accept the rules. They never obey the rules, either it is at their home or at the school. So around 5% of 10 years olds are thought to have CD, with boys outnumbering girls by 4 to 1. So around one third of children with CT also have attention deficit hyperactivity activity disorder. Now, some of the typical behavior of a child with CD or conduct disorder may include like frequent refusal to obey parents or other authority figures. Repeated truancy you can see in such children, the tendency to use drugs, including cigarettes and alcohol, at a very early age can be seen. Lack of empathy for others, they are insensitive for others' feelings. Being aggressive to animals and other people or showing sadistic behavior, including bullying and physical or sexual abuse. Keenness to start physical fights all the time, using weapons in physical fights. So, frequent lying is also one of the important behavior, typical behavior of children suffering from CT. Criminal behavior such as stealing, deliberately lighting fires, breaking into house and vandalism, these are all the characteristics of typical CD. A tendency to run away from home can also be seen among these type of children who are suffering from CD. Suicidal tendencies can also be seen, although these are very rare in these cases because they find pleasure in troubling others, but they do not find pleasure in troubling themselves. So, CD is really including all these symptoms. Now, attention deficit hyperactivity disorder, which we call ADHD. So, around 2 to 5% of children are thought to have attention deficit hyperactivity disorder, with boys outnumbering girls 3 to 1. So, the characteristics of ADHD can include inattention. Inattention is something where the child is actually not paying attention what is being taught to him, what is being said to him. So, this is something that child is actually not taking care what is being said to him. So this also lead to difficulty concentrating, forgetting instructions, moving one task to another without completing anything. They are actually in hurry to complete all the things very fast, but if something is not completed. So impulsivity, talking over the top of others, having a short fuse, being accident prone as well. Overactivity, constant restlessness, and fidgeting. So these are all the attention deficit hyperactivity disorders which we can see among the children. So students, we have seen that mental health disorders are very common in childhood and they include emotional obsessive compulsive disorder. anxiety, depression, disruptive, oppositional defiance disorder, what we have just seen, conduct disorder. And then we have seen ADHD also, attention deficit hyperactive disorder. A developmental speech, language delay, intellectual inability, disorders or pervasive. Autistic spectrum is also disorder. So emotional and behavioral problems can also be seen. And they are classified as either internalizing emotional disorders such as depression or anxiety, or externalizing disruptive behavior such as ADHD and CD. So the terminologies like of problems and disorders are interchangeably used throughout the study of the behavioral of the disorder among the children. So while low intensity, we can just think of this in that way, that while low intensity, naughty, defiant, and impulsive behavior from time to time, losing one's temper, destruction of property, and deceitfulness, stealing in the preschool children are regarded as normal, extremely difficult and challenging behaviors outside the norms of the age and level of development, such as unpredictable, prolonged, and or destructive tantrums or severe outbursts of temper loss are recognized as behavior disorders. So, community studies have identified that more than 80% of preschoolers have mild tantrums sometimes, but a smaller proportion, less than 10%, will have daily tantrums. So, regarded as normative misbehaviors at this stage, challenging behaviors and emotional difficulties are more likely to be recognized as problems rather than disorders during the first 2 years of life. So initially it is in the problem phase, but if the problem phase goes to the disorder phase, then it becomes little challenging for the parents as well as for the teachers to handle those situations. I hope you are understanding. So when we talked about emotional problems such as anxiety, depression, post traumatic stress disorder, PTSD, we call this, tend to occur in later childhood. They are often difficult to be recognized early by the parents or other carers, as many children have not developed appropriate vocabulary comprehension to express their emotions intelligibly. So many clinicians and carers also find it difficult to distinguish between developmentally normal emotions from the severe and prolonged emotions distress that should be regarded as disorders. So, emotional problems, including disorders, eating behavior, and low self image, are often associated with chronic medical disorders such as atopic dermatitis, obesity, diabetes, and asthma, which lead to poor quality of life. So, students, we have to understand that identification and management of mental health problems in primary care settings, such as routine pediatric clinic for family medicine, this must all should be given. So, childhood behavior must be systematized. So, it is actually any abnormal pattern of behavior which is above the expected norm of the age and level of development can be described as challenging behavior. So, this is the challenging behavior that must be cured as soon as it is possible for the well-being of the child itself. So it has been defined as culturally abnormal behavior of such an intensity, frequency, or duration that the physical safety of the person or others is likely to be placed in serious jeopardy, or behavior which is likely to seriously limit or deny access to and use of ordinary community facilities. So, we have seen many instances of challenging behavior can be interpreted as ineffective coping strategies for a young person with or without learning disability or impaired social or communication skills as well. So, disruptive behavioral problems include attention deficit hyperactive disorders, oppositional defiant disorders, and conduct disorders. They constitute actually commonest EBP, emotional behavioral problems among the children. And this is actually how we have seen that when we talk about deficit hyperactivity disorder, attention deficit. So ADHD is something where we are having different types of problems in this, and we have understood that attention deficient is something that CD refers to severe behavioral problems characterized by repetitive and persistent manifestation of serious aggressiveness or non-aggressiveness behavior against people, animal or property, such as being defined or belligerent, destructive, threatening, physical, cruel, deceitful, disobedient, dishonest, excessive fighting or bullying all the time, fire sitting, stealing, repeated lying, intentional inquiry, forced sexual activity, or frequent school truancy can also be seen. So, children with CD or conduct disorder often have trouble understanding how other people think, sometimes described as being callous and unemotional. They are considered to be unemotional. They may falsely misinterpret the intentions of other people as being mean. They may have immature language skills as well, so lack the appropriate social skills to establish and maintain friendship, which aggravates their feelings of sadness, frustration, and anger as well. So when we talk about the definition of conduct or disorder and oppositional o defined disorder, that is ODD, so we see that in ODD a pattern of angry irritable mood, argumentative defined behavior, or vindictiveness lasting at least 6 months, as evidenced by at least 4 out of 8 symptoms from any of the following categories. So, and exhibited during interaction with at least one individual who is not a sibling. So, angry, irritable mood is there in ODD, and then often losing the temper is also shown by the children and is often touchy or easily annoyed. You have to see this is often angry and resentful. So, argumentative defined behavior is also seen, often argues with authority figures for children and adolescent also. So often actively defies or refuses to comply with whatever laws are made. So request from authorities figure to or with rules. Then if we talk about conduct disorder, so it is a repetitive and persistent pattern of behavior in which the basic rights of other or major age appropriate societal norms or rules are violated, as manifested by the presence of at least three of the following, which I'm telling you, the 15 criteria in the past 12 months from any of the categories below. So, with at least one criterion present in the past 6 months, so like aggression to the people and animals, often bullies, and intimidates others, often initiate physical fights, has or used a weapon that can cause serious physical harm to others as well as himself also, like bat, brick, broken bottle, knife, gun, and these are easily carried by the children. So has been physically cruel to the people, has been physically cruel to the animals, then has stolen while confronting a victim. So, mugging, purse snatching, extortion, armed robbery, these are examples of CDs. Has forced someone into sexual activity, destruction of property, has deliberately engaged in fire sitting with the intention of causing serious damage, and has deliberately destroyed others' property other than by a fire sitting. So, deceitfulness or theft has broken into someone else's house, building, or car, often lies to obtain good or favors or to avoid obligations, has stolen sometimes of non-trivial value without confronting a victim, shoplifting but without breaking, and entering forgery. So, students, these are actually some behavioral disorders which we have discussed. And it's really very important for everyone to understand about these behavioral problems among the children. And specifically, I'm talking about teachers because the teachers are going to help them in that way. All right, students. So these are some references for your more study purpose, and I really hope you will be studying and revising the concept in a very good manner. And I really hope that you have enjoyed today's lecture. And so, students, just believe that students or children are really very good when they are taught skillfully, when they are taught as well as when they are understood. So it's really very important and essential from the part of teacher to understand the behavior of the student to teach him in a very effective way. All right, I hope you have understood about behavioral disorders in children, and so keep revising it. See you in the next class. Till then, stay safe, stay happy, and keep studying. Thank you, students.